All right, welcome back, everybody. We're going to start off with our accessory skin. This is not the skin. Well, it is kind of the skin. And so much more. So I have to be honest, I do kind of talk differently because I know I'm recording, and so I know this is going to exist forever and ever. So, so please remember to subscribe to my channel so that I can have that little emotional boost that I know. Well, I think you have to have like 1 million subscribers before you get paid. So if you tell a friend and they tell a friend and they tell a friend, who knows? I might become the next greatest internet sensation.
Like Dr. Phil.
Dr. Phil. But I have some groups that are going to be making me, I think, designing the banner. So it's going to, they wanted to say, you know, Ziza's Science or something like that. So anyways. I think that this is where we left off, a little bit past this, but we wanted to talk about the accessory sex glands of the male reproductive system. And you just took your quiz. The next couple of slides are specifically about the prostate gland, and this is something I just double-checked my sources about the prostate gland. And cancers are the second leading cause of death in men. The number one leading cause of death in men is heart disease. Okay? So eat your veggies. Stay away from Cheerios. Cheerios are bad. No, unnecessary carbohydrates. Eat an apple a day. That'll keep the doctor away. And it'll be, as long as they're organic. Eat an organic apple a day. Cheerios, there's not enough fiber in there to really do anything for you.
But it says that
It says.
Oh my gosh. That's a successful marketing, and you guys have believed it. We've all believed it. Carbs are bad. Okay, we talked about the pre-ejaculate in the part 1 of this lecture, so I'm not going to mention that again. But just understand that the withdrawal method does not work. Yes, if you try to pull out before full ejaculation, remember that pre-ejaculate can also carry sperm. All right, so cancers are the second leading cause of death. Of all the cancer deaths, however, prostate cancer was like 8%, I think, from the American Cancer Society. So you can have, guys, an enlarged prostate gland and not have cancer. Okay, you can have hypertrophy, and then sometimes it can become. So benign means it's not cancerous. Okay, benign prostatic hyperplasia means overgrowth of the prostate gland, and you would know this when you have an urge to urinate. A lot of times you would have to wake up in the middle of the night multiple times, and you can't get a forceful stream of urine. It just kind of trickles. And that's because, look at the placement of the prostate gland. Where do you find it? Underneath the bladder, and it surrounds the urethra. So if it becomes overgrown, it will actually pinch off the urethra, making it very, very difficult to urinate. And maybe so difficult that your urethra can become completely blocked, and the only way you can urinate is through insertion of a catheter, which you can do yourself at home. That is inserting a tube up the urethra. I'll pause for dramatic effect. And the tube goes on up into the bladder and then drains the bladder. And it's uncomfortable, but not painful. Well, the problem is if you've got a full bladder of urine and you can't go to the bathroom, you can't stay like that. And so when you learn how to catheterize yourself, then it's like, oh, I can go to the bathroom, and that's a relief.
So when you just go up the hole, that's it?
You clean everything so you don't introduce bacteria from the outside into the inside and give yourself a bladder infection. And yes, you insert the tube very carefully up the urethra.
And it just flows out?
And it just flows out. Now, if you happen to be in the hospital and have a surgery, for example, where you're unconscious, during the surgery, or you're sedated, heavily sedated, and you don't have any control, they give you a paralytic drug like propofol. That's the Michael Jackson drug, right? The one that paralyzed Michael Jackson to the point, sedated him to the point that he stopped breathing. Propofol is what's used in surgeries, and it paralyzes all of your muscles. So if you are paralyzed for surgery, they're going to put in a catheter and they're going to drain your urine into a bag because you wouldn't have control, and they don't want you, urinating everywhere during surgery. If you're paralyzed because of a spinal cord injury, for example, you lose control of the voluntary skeletal muscle, the urethral sphincter muscles that would allow you to control when you're going to urinate. Okay? So, just so you know. Question?
Prostate cancer is so popular.
What's the cause of any cancer? Well, okay, so don't say it's so popular like everybody wants to get it. Prevalent. Why is it so prevalent? Why is it so common? Why does it happen so much? I think that, first of all, we've gotten really good at detecting these types of cancers. And so we see that the numbers are increasing. And maybe that many people have always had the cancer. People used to just die and they didn't know why. So it's mutation of cells. Now, are there things that cause cancers? Are there chemicals in our environment that we're exposed to? Yeah, a lot of people think so.
Doesn't it say that on the window of McDonald's?
Doesn't it say that where?
At McDonald's, there's like a warning thing. It's like.
Oh, a warning. Yeah, there's chemicals that are used in this facility that have been known to linked to causing cancer. Yes, but that's based upon that's a blanket statement. Exposure to radiation causes cancer. But yet we're exposed to radiation every single day, gamma radiation from space. So we're exposed to lots of natural things in the environment that we've always been exposed to. And sometimes people get cancer. Why do we see so many women with breast cancer? Well, now we can screen for it, and we find it very early. So a mammogram really doesn't hurt. Okay, so a weak or an interrupted stop and go flow of urine, sudden urge to urinate, like you just got to go, especially at night. Trouble emptying the bladder completely. You just went to the bathroom, but there's still urine in there. This is all related to the enlargement of the prostate gland. So how do they screen for prostate issues? Okay, the traditional way that they've done it is, in order to palpate or to feel the prostate gland, they have to go in rectally. Okay? One finger into the rectum because of the position of the prostate gland. In order to feel if it's enlarged, you have to go in that way. But now, much more commonly, they're started doing a screening with a blood test called a Psa test. Okay? And I read a little bit about this. Hold on a second. We have an interruption. Okay, so this PSA test, sorry that we had somebody at the door. The PSA test is looking for, if you have prostate cancer, okay, if you have prostate cancer, you have a normal barrier that keeps this chemical here, prostate-specific antigen, PSA. It keeps it inside of the prostate gland, and it only allows a little bit through natural diffusion out into the bloodstream. So your PSA level would be low. But in the event that you have this overgrowth of these prostate glands or a hyperplasia, the cells are not able to do their job properly, and it allows a leakage of this antigen into the bloodstream, and so you have an elevated level of PSA, and that's what they can screen for through a simple blood test. After that, then they would go in and do ultrasounds and MRIs to see what's going on, and they can, with radiation and chemotherapy, if it ends up being cancerous, they can shrink the size of the prostate gland. As a last resort, they'll go in and remove the prostate gland. But that's a difficult surgery because of its location and its proximity to other structures. That means how close it is to other structures. Prostate surgery, this is all soft tissue, so they can make an incision and probably, I'm not positive, but my guess would be they would go in through this region here. It's the most direct access. Yeah. From the area in front of the anus, behind the scrotum. Like where they would go in and do a vasectomy. That's my guess, that they would go in through that area. The problem is there's a couple of structures First of all, the urethra. You have to leave the urethra intact, and remember the prostate gland goes around the urethra. So surgery of the prostate gland is tricky, and they're doing a lot now with robotic surgery, where they use robotic-enabled lasers and things like that to go in and cut out much more precisely than just the doctor's, what the doctor can see. The other thing is there's a nerve that is involved in erections. And so one of the side effects of the surgery sometimes is men having a difficult time getting and sustaining an erection. And this is where Viagra and stuff like that comes in. Okay? But very, very common. I have uncles, several of my uncles that have had prostate issues. Enlarged prostate gland that's benign, just gets enlarged, and then also prostate cancers. But look at where the prostate is. Guess what? If you have cancer and it's untreated in the prostate gland, where's it going to go? It's going to go to your bladder, and you're going to have bladder cancer, or to your rectum, and you're going to get colorectal cancers. So this is something, guys, go get the blood work done when you start to get into your 40s, and so it'll be a part of your normal screening. Question? This is why, yes, because as you get older, just like women, once you get into your 40s, you'll get mammograms, prostate, once you get into your 50s, then you get your mammograms, and then they also start checking you for colon cancer and doing all kinds of endoscopies. All right. So, external genitalia on the male. The penis, this is a cross-section of the penis, and you can see here, I'm not going to go through all of the parts, but the penis is able to fill with blood, and the blood vessels carrying blood into the penis stay open, but the vessels that would drain the penis close, and that's how a man is able to get an erection and maintain an erection. And so you have these chambers of tissue, corpus cavernosum and corpus spongiosum. Cavernous, think of large openings that fill with blood, and then spongiosum, it's a sponge, it fills up with blood, and that's what makes the penis rigid during erection. So the arteries dilate, large amounts of blood enter, and then don't come back out. You have this kind of tissue in other places in your body, your lips, your earlobes, and your nipples. So all of those structures can fill with blood and become plump. So you know that plumping lip gloss, ladies, that's out there on the market right now? And you put it on your lips and you start to feel tingling and your lips kind of get fatter? What that is it's chemically... it's chemically stimulating the release of blood flow, and it plumps up your lips because your lips become more engorged with blood. Okay? So I just got one in my little, what is it called? Ipsy, where I get, you get a thing for $20 every month. And I just got one, and everybody that tried it, we're all, I forget the name of it, but it stings your lips. And we don't like it.
Did you get the toothpaste?
I don't know. I don't think it's Too Faced. It's some other company. I'll have to look it up.
My mom gets those too.
So, okay. Moving on. Any questions about, can you break the penis? Yes, technically you can. And if a man has an erection and he bends his penis too far, what will happen is one of those cavities will rupture. I know. Wait. Okay. The tissue would grow back, but I think that it would permanently not. No, it's not broken off. It's just broken, ruptured the tissues. Yeah, it would swell. It would be. Yeah. Okay. Question? Shh. It's a soft tissue injury. There's no bone in there, really. Now, other animals, like whales, for example, have a bone. I think walruses have a bone in their penis. But we're not talking about a bone breaking. You're talking a soft tissue injury. Okay? All right. Erectile dysfunction. This is a case when the penis cannot become erect because of lots of different medical conditions. Diabetes is a big, big one. Prostate cancer, another big one. Stress and depression. So this is where we have these drugs, Cialis, Viagra, you know, when that moment becomes the right moment. And what these drugs do is they increase nitric oxide levels, which is laughing gas, which is a vasodilator, allowing more blood to go into all parts of your body. And the reason why they have all these warnings with these medications is because you have to be healthy, and you don't want to have heart conditions because you start vasodilation, all blood rushing to all parts of your body, and you don't want to have a heart attack. So that's how those drugs work. Circumcision. There is so much misinformation out there about circumcision. How many men are circumcised around the world? So it depends by country, obviously. Okay? These are the percentages. So the source, according to the World Health Organization, the bar graph down on the bottom, you look at a country like Nigeria, and it says 95% of men are circumcised there, according to the World Health Organization. 75% of men in the United States are circumcised. But then you go to something like the UK, okay, and many more men are not circumcised than are circumcised. So what is circumcision? Well, first of all, within a couple of days of birth, unless you're Jewish, and if you're Jewish, there's another religious ceremony, and I'm not sure, it's called a bris, but it's done by the rabbi, and it's a religious ceremony, and it's done, I want to say weeks after the baby's born, but don't quote me because I'm not sure. But usually it's done before the baby leaves the hospital. And they're going to remove the foreskin from around the end of the penis, and you can see in the picture on the top right what an uncircumcised penis looks like compared to a circumcised penis. There are different ways of doing it, of removing the foreskin. When a man's penis becomes erect, however, the foreskin pulls back, and an erect penis looks like a circumcised penis. The foreskin completely pulls back. Why have a foreskin? That is an extremely sensitive part of a penis, and it protects the end of the penis from stimulation. Okay? In a woman's body, we over the clitoris, there is a fold of tissue called the hood, and that is analogous to the penis. So the woman's anatomy also has a structure similar to a foreskin. Why is it done? The primary reason circumcision is done is for social reasons. Okay, going back to Christianity and marking your children. The Jews marked their children different from the Gentiles. So you knew that if you were circumcised, you were Jewish. And then that just continued on with Christian tradition. Okay? A man who is not circumcised is no less clean than a man who is circumcised. And you just learn how to wash your body. It's just you pull the foreskin back gently and you wash underneath the foreskin, and there's nothing, It's a very, very quick procedure. There, yes, have been horrible accidents with children where they have been, permanently maimed by mistakes during circumcision. Okay? It's not that common that they make mistakes, but it happens. It has happened. Okay, so one of the things that we've talked about before is HPV, Human Papillomavirus, and the vaccine for it. And so I know that one of the reasons why they advocate for a man getting circumcised is because of spreading diseases. He's cleaner, and so he's not going to spread infections to his mate. So looking at the risks of HPV, it's really not that there's really not a direct correlation between HPV and cancer. Okay. In general, HPV is thought to be associated with 40% of penile cancers. So remember, we had cervical cancer in females being associated with HPV. It seems there may be a connection between getting penile cancer, and yes, there is cancer of the penis, okay, and HPV. So another reason, guys, to get that HPV vaccine. You're like, well, I don't have a cervix. I'm never going to get cervical cancer. Well, you know, there is. And there are different types of HPV over here. Okay. So it may be a circumcised man has a less of a chance of having HPV, or he doesn't transmit it as well. So I think the jury's kind of still out on that one. All right. We've already seen these on the female reproductive system. And so now we're going to jump ahead and talk about STDs really quickly. And I'm going to stop the recording and make a separate recording on STDs so that if someone doesn't want to watch that part, they don't have to.